2020 will be the toughest year of our lives.
We're at war. We're at war with the virus.
The world has changed. Australia has changed. And we're all in this together.
When you're in the midst of a pandemic, you think this is the end of the world. I saw through HIV that we do come out the other end.
This is a public health emergency. We need to understand what's happening in the other countries. The people that have got the most control of this are not the government, not the doctors, it's the people.
What can you do at home to keep things from getting out of hand?
On the one hand, I'm anxious and, we're looking at all these ways of coping. On the other, I really feel that we've reached a moment in time. We can get through this. We will get through this.
It's so easy to get trapped in your misery scroll or to just leave the news on and feel really bad about your day. Positivity is going to bring us through this.
It's been a day of extraordinary developments. The Prime Minister asked people to cancel all non-essential domestic travel.
There is no 2-week quick fix. There is no 4-week shutdown and it all goes away.
Well, some hospitals are reportedly short of protective gowns, gloves and masks, and they could run out by next week.
John Fraser, I'm an intensive care professor and a researcher. I'm in charge of the critical care research group at the Prince Charles and the director at St Andrews Intensive Care in Brisbane. The last bastion for the most seriously ill is intensive care. And we're trying our best. Globally, we're trying our best, but we have never seen this disease process before. The concerns around personal protection equipment are global. We've got people in Italy phoning and writing to us, do we have enough? Because the whole world suddenly needs a massive amount and no system is ready for that. So it's an unsafe working environment. And I do. Thank you. I'll see you. Yep. So bright and early, 7:30 Monday morning, rocked up to a hardware store, the first time ever. Have you seen how soft these hands are? I've never done hardware in my entire... To see exactly what they had and whether we could use asbestos masks in an intensive care environment. And met a lovely anaesthetist that I've not met before from the Princess Alexandra Hospital. And she was there for exactly the same reason.
So in terms of systems, I'll call all out Ben.
We are the people that look after your breathing with the life support machines, the ventilators.
Other than that, you go up to a full face.
Our job will be putting these breathing tubes in as this virus is getting excreted. In the aerosol load, there's a substantial amount, and that's where one of the big risks are. In Italy last night, there was a note came through, 16 of the intensive care specialists have died.
Wow.
Because they've run out of masks.
I'm here today because I've been watching what's been evolving around the world, and I'm just worried that we will be in the same situation as Italy, even Britain. Stories are coming out about doctors being ventilated, even dying, so I think we need to try and do something and take this time that we have to prepare.
You will get better
because they've run out of masks.
Tight-fitting masks.
So what would you, if you're going to go in and someone's got COVID and you're going to be putting stuff down,
Yep.
what would you buy?
Full face, positive pressure.
I'll have several of them, thanks.
Hi, Mark.
Yeah.
We all feel very uncertain. It's an uncertain time for the whole community. I mean, people are losing their jobs. It's really, it's very uncertain.
Is this yours in?
This will be mine.
Okay, sure.
Yep. So just normally that. I am concerned about getting sick. Who wouldn't be?
Yeah, so as long as it's all set up on your chin.
Is that a medium, large?
And I've got 5 kids at home, and I'm concerned I go to look after patients, but in doing so, I give my children an additional risk. So it does concern me. I can't do anything about it, and it is my moral responsibility to go and look after people that are sick.
Total 6,913.83.
Okay, thank you. Here's a question, have I paid the credit card?
We sign up to do this job, and that's our role, and for once in our life, we can really make a difference, and I don't think that I could get up in the morning and feel good about my job or my career if you couldn't step forward at this point. When the community need the skills that we've been trained with, so that's what most of us feel. But sure, I'd love to go and hide out in a remote property with my family and wait until it's all over, but I just don't think that's an option. It's just not.
Tom! So I called my 5 children together and a couple of the girlfriends because they're much more sensible, and talked to them about what might happen. Not to be alarmist, but see, I might get sick.
We're probably all going to get infected eventually, but what happens if I'm going to get infected first? Which one of the alpha males is in charge?
I wanted them to understand and have a rationale, a plan. That's what we do in intensive care. So the plan would be to split the house in 2, dirty and clean. We've got a lot of boys in this house, and most of it's dirty and dirty.
So what I did the other day was I bought a kettle and a microwave for downstairs.
Do you want to stay downstairs with the microwave, because that's all you can cook with?
So there's a fair amount of humour. That's number one, typical of my children. But I think that humour is hiding a little bit of, oh my goodness.
You know, it's scary to think that Dad's going to go and one day he's going to be like, going to get a call going, oh, I've got corona.
Yeah, it's not a nice thought to think about your parents getting sick, but...
He is at the age of 50, like, he's kind of old. He's ancient. But, like, he is quite healthy.
There's a big enough number of us that can look after each other, but we're going to have to work out who's going to run the finances.
We talked about the credit card. We talked about how the cooker worked. We also talked about power of attorney and wills. We didn't spend long on it. I don't think it'll come to that, but it could.
What do you think I should do?
Still going in hospital?
I think the one I'm most concerned about is Thomas. He's 9, but he's not stupid. So each night when there's phone calls between Italy and the USA, he's hearing about deaths.
So what's the most worrying bit about the virus thing for you?
I don't know.
And then at night time he'll say, Dad, could I die? Dad, what happens if you get sick? Dad, who's going to give me pocket money?
I think we've got America joining us. Nan Bodie was at another meeting. Can you just give us an update where you think we are in terms of how many intensive cares we've got up now in how many countries? The key is we don't know how to treat this disease. So we have to have an understanding of what's happening across the world.
In not even 4 days, more than 1,000 patients.
But if we can gather all the data, we've now got a team from Sydney and from UQ of artificial learning. So if we get enough data and we get it quickly enough, that machine learning can give us decision support, and it can give us predictions, and it can say who gets intensive care, who doesn't. So you've already had to increase the bed capacity.
I have never seen a study where 39 countries said, we'll join you, here's our data. And that's because they're desperate to do the right thing by the people.
The best thing that we can do is to join this project.
And I just say to the population, the people that are going in Bondi, the people that are having house parties, you know, if we can survive in 3 or 4 hours sleep a night, surely you can sit inside.
We are declaring a state of emergency in Victoria.
This week's shutdowns across the country have all been done with one thing in mind: to flatten the curve.
David Patterson. I'm an infectious disease physician at Royal Brisbane and Women's Hospital, and I'm also director at the University of Queensland Centre for Clinical Research. We know this novel coronavirus is like a bullet train hurtling towards us, and we as doctors, as scientists, we've got to act now. We've got to do something because this is going to be catastrophic.
And after it's been incubated over...
Realistically, it's probably that we won't have a vaccine until 2021, and that's why it's important to get out there with trying to work out what are the best treatments. Are there even prevention strategies with some of these drugs that have been used for many, many years?
We can incubate it and have a look at it under the microscope.
There's a group of doctors all around Australia who are specialists in infectious diseases. They were able to very quickly put together a clinical trial that would involve multiple doctors in multiple hospitals all around Australia.
We're ready now to be at the front line and get patients into this trial so that we can find answers.
Tonight, an epidemic they call the gay plague
thousands of Australians may die in the next...
Back in 1985, when I was a medical student, it was right in the early days of the HIV and AIDS epidemic. And every person I looked after ended up dying. So that really is how I got into infectious diseases. He was an emerging virus with so much in parallel with COVID-19. There's no cure, there's no vaccine, there is stigma, there's a lot of hysteria.
The fact is, over 50,000 men, women and children now carry the AIDS virus.
Now when I see a patient with HIV, I tell them, you're going to live until you're 90. Let's hope we can get to that sort of situation with COVID-19.
Hong Kong residents are taking no chances as the outbreak of severe acute respiratory syndrome worsens.
SARS and MERS were also novel coronaviruses that did cause big problems.
The government says there's no need to panic.
After SARS, there was a fair bit of rigorous experimentation that went by, looking at what off-the-shelf drugs that we might not necessarily have used particularly much for anything anymore, were they active against novel coronaviruses?
One of the drugs is for treatment of HIV infection called Kaletra. And then the other drug is hydroxychloroquine, which we've had for more than 60 years to treat malaria. And it was therefore of interest to see whether these drugs would block the immune explosion that happens when people catch one of these viruses. In China, they did some laboratory experiments on people taking those drugs versus people not taking those drugs. But it was never really conclusively proven whether it worked or it didn't work because SARS disappeared, and then we had the MERS outbreak. And again, we didn't have the chance to test because it came and went so quickly.
We'll be doing a randomised trial where we're going to compare an old HIV drug, an old malaria drug, and the two of them together. For this trial, we want people who are sick enough that they need to come into hospital. So in other words, there's a chance they might not get better by themselves. And we've got to rigorously assess whether, in fact, what we're doing is preventing people from dying.
Like all drugs, these can have serious side effects, and that's how terrible mistakes get made, and we have real disasters happen. And therefore, they should be studied and have been shown in properly conducted clinical trials to work.
So this trial's being led from the Doherty Institute in Melbourne, along with others from around Australia and New Zealand. That process normally takes 6 to 12 months, and we're planning to do it in a number of weeks.
One thing I really want to emphasise is how big a team effort this has been. We've got at the moment 60 hospitals that want to participate, and the sooner we get all of them on board with the trial, the quicker we'll get results.
Overseas now, the US President Donald Trump has called on regulators to expedite potential therapies aimed at treating COVID-19.
It showed very encouraging early results, really encouraging. I think it could be a game changer, and maybe not.
Unfortunately, Donald Trump went on TV and said that hydroxychloroquine will be a game changer in this pandemic. That was picked up by all major media outlets and was disseminated around the world within minutes to hours. It was very unhelpful, him saying that, because as a result, people have stockpiled this medication to prevent themselves getting infected. Now the wholesaler is sold out.
Just like there was a run on toilet paper, we have seen a run on this potentially effective therapy. But we don't know that it's effective. We know it's got potential side effects. People have even gone blind from the drug or had serious heart arrhythmias. It's come to a point now where we're having to say to people, just stop. We don't have the evidence yet. It's a hunch. Epidemics in the 60s and 70s. We're just about there. It should be within days now that we have our first patient into this trial. And it's really going to be an exciting time, but also a nerve-wracking time, really until the trial is finished and we know whether we've helped patients or not. We're all going to be on the edge of our seats.
The rapid shutdown of many non-essential services has seen tens of thousands join the ranks of the unemployed.
They're like scenes from the Great Depression, long queues of Australians trying to access support.
Everyone's a little bit funny and on edge.
Everyone's anxious, no one knows what's going on.
I'm Dr. Mark Cross. I'm a psychiatrist with a special interest in anxiety, PTSD, and anxiety in the workplace. I've got a specific interest in anxiety because I also suffer from anxiety. I've done so since the age of 4, and it runs in my family as well. This is an unprecedented time, and it's causing a lot of uncertainty. It's really hard. I don't think many of us are coping 100% with all of this. Of course, people are catastrophizing, and it's very hard not to, because I'm trying to not catastrophize myself. I've got to practice what I preach, right? I'm finding it hard. I worked at Liverpool Hospital for many years in the Department of Psychiatry there, and I was involved in the groundbreaking TV series Changing Minds.
Look, I'm a psychiatrist. I can cope with crazy. That's not a problem. And I don't call my patients that anyway, so don't worry about that.
We have real difficulty in the medical world accepting mental health issues. I was taught and trained, and it was drummed into me that as a doctor, you have to be stiff upper lip, you have to be perfect. I feel easier now talking about my sexuality, which, wasn't very easy for many years, than actually saying that I've got anxiety, because that's accepting, in a way, or acknowledging that I have a mental health condition. Okay, yes, and I'll send the prescriptions through by fax, and I'll see you tomorrow. Okay, bye, cheers. I'm feeling the pinch, and I'm trying to cope as best I can. Hey, Tim. Thanks for waiting.
Mark, how are you, boss?
I'm okay. How are you doing? But my patients are really not dealing with this very well. So from now on, I'll be working from home, and I'll be interviewing and reviewing my patients via the phone or video link.
Now with this social isolation, doesn't make it any easier.
No.
But, however, I completely understand. Nip it in the butt as quick as possible. But no, anxiety's through the roof at the moment.
Yeah, okay.
I understand why people are feeling the stress and anxiety. Hey, I'll put my hand up and say I'm feeling it massively. But without community, we're screwed. It doesn't matter how good or how bad it goes. If we don't have community, we've got nothing.
Remember what we normally talk about, right? Talk about what you can do for yourself, and you got to do things for yourself and your family. What's your business name again?
So the company that we're starting at the moment to help the veterans, worst business name ever. It's the United Handshake. So as you can imagine, that doesn't go down too well at the moment.
We've got to keep our sense of humour. Australians have a great sense of humour, and that's keeping people going, and it's also a connection, right? And you're using breathing, so some of the stuff that we talk about most times, you're using your breathing and you're stretching in the morning.
I love my stretches, and it just makes you feel a bit better.
What we always talk about, when you look at coping strategies, so individual ones, yoga, breathing, stretching, but also I try mindfulness. So mindfulness really is concentrating on being in the present and focusing on what you're doing. And so people often say anxiety is living in the future, right? So you have fear for the future. So you've got to really try and focus on and ground yourself in the present. And I find that that's quite useful. Whilst we're all anxious and we don't really know what's in store for us, we're smiling at each other. Maybe with the slowing pace, I feel it can be a nicer time as well. From last Friday to now, this week, so less than a week, we've seen a massive shift worldwide. And I think the world has changed irrevocably. We cannot go back to business as usual. I don't think we ever can. All my conferences, meetings, lunch dates, they've all been cancelled. And I feel a little lighter. And then I think, Does it take a virus to teach me how I should live my life in a more balanced way?
Children should go to school tomorrow.
We'll be encouraging parents to keep their children at home.
Should I listen to the principal here or the Premier or the Prime Minister? Who?
What we're seeing is absolute confusion. And against that backdrop, what we will have is chaos in our schools.
I'm Gareth Leishman, Headmaster of Arndell Anglican College. I've been a headmaster for 13 years. I've never had a week like this. Not in my 47 years of existence, I have not gone through this process before. Morning, Ozzy. Good, how are you? As a leader, people look to you for guidance during this time. You've just got to remain calm and in control. Arndell Anglican College is situated about 55 kilometres west of Sydney. The status of the school this week is we are open for the students. As I start each day, I think there's a consistent theme of my thoughts. First of all, how many students am I going to have at the college? Yesterday, we were down to about 140, 150 students. So it'll be interesting to see today. I'm predicting that we'll actually go under 100 today. Nobody today?
No one.
None.
Not on this one.
All right, cheers, mate.
Boys, take it
Thanks,
easy.
same to you. For the students who are here, who have been here since Monday as a large group of 900, to now be here today in a group of less than 100, that must be totally disconcerting.
Yeah, I think it's kind of confusing because at the start of the week, I've been coming to school the whole week, and it wasn't as stressful because you were seeing other students, but as the days go by, we're down to, 30 people today? And now the stress is kind of coming in. Am I meant to be coming or am I meant to be staying home?
Where'd you go? The second thing that goes through my head is my staff wellbeing. How many staff am I going to need to chat to today? I've learnt that being present is really important. Being there to listen to kids, being there to listen to staff. Are they coping?
Yeah, we'll get around and just make sure that everyone's okay and support the best way we can today.
Yeah. I've got teachers who are, gravely rightly concerned about their own wellbeing and health. Are they being exposed to COVID-19?
My husband's still working, and that's what he says. Every day he drives past Centrelink, and he says, just seeing the line, it's heartbreaking. I know, it's terrible.
The most challenging aspect for me this week has been knowing people I know lose their jobs.
Currently, I'm unemployed, so it's just a bit heartbreaking. Yeah. Hopefully we get to the bottom of what's going on, so all Australians can get back to normality. It's just not affecting us, it's affecting the kids as well, and that's the most important thing. It's the children that we need to worry about for the future.
I'm going to pop round about 9, quarter past, just to see how many kids you've got on site. Thank you. Being caught in the centre of a national debate such as education in the current climate has been very challenging, I think, for any school leader. So there's no notice came out last night from the Prime Minister?
No, there's a press conference going on right now.
Oh, is it?
But it appears to be about just the self-isolation and stuff like that. But the AMA has come out this morning calling for schools to be closed.
Yeah. We've got political pressures. You've got pressures from governments who are trying to say, on one hand, let's have social distancing, but on another hand, can we make sure we're staying open? And this is one of the things with schools. We're lucky, we've got a lot of space. But for a lot of schools, it's almost impossible to keep that social distancing. It's just not practically possible. And I think that's where some of the confusion lies for educators. I think what I need is a clearer message. I think educational leaders are being asked to interpret and then communicate. And we're just hoping that our interpretation's correct. In terms of anxiety and worry amongst the students of this college, the obvious group is Year 12. They are doing their HSC.
At first, I thought it would be a lot better to be at home and safer for everyone, especially my family, but I'm finding it pretty hard to transition to online learning, so I've decided to come to school today.
Hello, people. How are we going? One of the real obstacles we face is that for not all of our students, is home going to be the best place for them to learn? How's it all going anyway, out of interest? Is it actually working?
It's all right. Like, I find it a bit harder to concentrate at home because, like, you got siblings and animals and everything.
So my view is that you might need to actually start getting used to this. I think everybody's now dawning on this is the way life's going to be for a few months yet. But what I'm finding is at recess and at lunch and in the after school when I'm wandering around, I'm seeing a lot of happy faces of kids in class. So the kids who are here, I think, are feeling very safe and secure. Thank you so much. Do you want me to take that? That's lovely. That is lovely. It was only you two today?
Yep.
All right, you go back in.
Okay.
Thank you so much.
Bye.
Bye. Staff are actually able to cope in this situation, and they're actually showing that and they're displaying that, and many of them are starting to thrive in it. In 5, 10 years' time, when I look back, I would love to say that we not only survived COVID-19, but we thrived. We actually became better for having gone through the experience.
Life as we know it and the freedoms we took for granted are fast becoming a memory.
Border closures take effect in South Australia, WA and the Northern Territory today.
If you're flying back in and you don't isolate for 14 days, you'll get a $1,000 on the spot fine.
The Prime Minister wants people to stay inside and work from home.
My name's Astrid Jorgensen. I'm a musician and a choir director and probably best known for my work with pub choir. We're going to call it Couch Choir. I'm going to post it. Got to get it out. It's up online. Sunday night last week was the culmination of the craziest week of my entire life. Going from the absolute high of maybe our career peaking in America and then the absolute low of losing everything. But then realising that no, like singing is still real and there must be a way to still connect with each other even though we're at home alone. And Couch Choir was the solution to that.
1, 2, 3.
Pub choir started in 2017. I really love singing in choir and I've always been confused why my friends don't join as well. And it seemed like an obvious thing, but take choir out of like maybe a church hall and put it in a pub. Because you sing better when you're relaxed. And then it's all just more beers from there.
So this is how it's going to be. I'll sing at you and sing back what you think just happened. And we'll go from there, okay?
I guess from where it started, didn't really imagine that it would get this big. We've been travelling around the world. The fact that anyone can come along and sing with Paul Kelly or someone like that is pretty magical.
Pub choir was in America and then coronavirus pandemic was coming into consciousness and it got scary. We realised that our shows were definitely not going ahead and that we had to leave America as soon as possible.
When we came home, we made sure we all got tested and that we all isolated. And when you are in isolation, you do feel isolated, like it's exactly what it reads on the box.
Just had a brainstorm and realised that singing still exists anyway, but we just can't do it near each other. And everyone's online at the moment just scrolling, and I realised those two ingredients together is the solution.
Welcome to our first attempt at Couch Choir. We have sung through 3 different harmonies for Close to You by the Carpenters. So you record yourself singing your part, and when you're happy with it, you're going to send it back to us.
Don't stress too much about what you look like or what you feel like you sound like, or if you've made a mistake. We all make mistakes. I mean, It's one way that I guess we could bring everybody together without physically being together.
I'm going to sing through the whole part from start to finish.
And I'm going to sing the guy's part.
Why do birds... We had 1,000 submissions over 2 days. People from 18 countries, so it was way bigger than we thought it would be.
Just like me, they long to be close to you.
They want to be close.
Yes, Gary. She's nailing it. The magic was receiving the individual submissions because it was like very personal and intimate. And at pub choir, there's 1,000 people together and I don't know who they are, but for the first time ever, I met them individually. It'd be super easy to sink into misery because I've lost all my gigs for the rest of the year. Look at it! But it's so nice. It's so nice. These people sending in their videos is just like, it's like unwrapping a little gift. Or like 1,000 gifts. I have 1,000 gifts to unwrap. Paris Owen, my video editor, tore her hair out and didn't sleep for 3 nights and edited them manually together. What a legend. We're laughing so we don't cry. Yeah. Okay, I think it's just loaded. This is my first look at the video. I'm so excited, but also a bit nervous.
Why do the stars fall down from the sky every time you walk by? Just like me, they long to be close to you. They want to be close. On the day that you were born, the angels come together.
Seeing all of those voices put together in that way felt just as good as a room full of people.
So
many people!
That is why all the girls in the town follow you all around. Just like me, they long to be close to you. They want to be close.
It's so important to remind yourself that you can still make new, beautiful experiences, and this will end, and we'll all be there for each other on the other side of it.
This time we're using the internet for good, something really special.
I think we made something beautiful. If it's even 3 minutes of reprieve from what's going on in the world for people right now, I'm stoked.
Just